Muhammed Kabanda claims to have gone to Old Kampala Hospital for an operation on his head following a border accident in September. After the operation, he was shocked to discover a fresh incision on the left side of his abdomen. He had ultrasound scans conducted in 3 different hospitals, and reports confirmed that he was missing his left kidney. Since then, Kabanda has accused the hospital of illegally harvesting his kidney. The matter is under investigation by the police. However, according to Dr. Frank Asimwe, the president of the Association of Surgeons of Uganda, the Uganda Medical Dental Practitioners Council is willing to conduct an independent investigation into the matter.
We need to look into the story from the patient, story from the doctor, carry out a few more investigations, and let the law take its course.
Whereas the victim has provided reports from different hospitals, Dr. Asimwe believes harvesting a kidney in Uganda would not be very useful.
Unless and until we begin transplanting here, it is nearly impossible for one to harvest an organ and deliver it to wherever you are taking it when it is still viable. So that makes it a bit difficult.
Asimwe insists that the hospital and doctors should be given a benefit of doubt, since an incision does not necessarily mean an organ was removed.
We don't have a lot of skill to safely remove a kidney, plus the placement of that incision. That incision is not the one we make to remove kidneys. So for you to remove a kidney through that incision, it must be a little extraordinary. And if you're doing something illegal, there is no reason to try and be too smart. You go straight for where the kidney is. But that incision is a little bit off where the kidney is, a little bit, and would make the surgery very difficult.
As a urologist and a transplant surgeon, Asimwe says there is another possibility of someone being born with one kidney, but this can be investigated and proved.
Having a scan done and they don't see a kidney doesn't mean you were actually born with 2 kidneys. You may have been born with 1 kidney. So that's where the expert eye need to look at the investigations done. That bed, we call it a bed, where the kidney was lying. If it has never been there, it looks in a certain way. If it has been there and has been removed in the last 1 month, the last 2 months, there will be a bit of fluid, there will be a bit of edema. So you can tell a lot from the investigation.
When asked to comment on whether this hospital has the capacity to conduct organ transplant, this is what Dr. Asimwe said.
Kidney transplant, kidney harvest is not done anywhere by anyone. There have got to be specific requirements. So I don't know. I've never been to that hospital. I don't know their capability.
The alleged victim has already been taken to a police surgeon for examination. However, relatives allege that they were blocked from witnessing the examination.
We're all told to go out without an explanation. They closed the doors.
Relatives were not chased away. The doctor only says that first, I want to know the history, the medical history of the victim, and I want to be with him alone. So he told the relatives that step aside, I will call you later after what? Interacted with the victim.
We are going to wait and see the results in that report. If they are positive and compliance with the earlier reports, we shall come back and notify you on the next way forward. If not, as lawyers, we know what to do.
As a hospital, we deny all allegations, and the matter is currently under investigation. In that regard, we shall not make any further statement until all the investigations are complete.
Patrick Senyondo, NTV.